How to identify bipolar disorder symptoms, treatment, and prevention of suicidal thoughts. Before claiming that someone really suffers from bipolar disorder, it is first important to identify the symptoms to strengthen the educated guess, and make appropriate recommendations for treatment. In this video, you will learn how to identify bipolar disorder symptoms, treatment options, and how to do away with suicidal thoughts. Some of the keywords include mental health, bipolar disorder symptoms, treatment, health, disorder, mental disorders, mania, manic depressive disorders, manic depression, depression, psychological disorders, healthiest mind, etc. If you are new to Healthiest Mind channel, welcome to our channel and please subscribe for more interesting videos like this. How to identify bipolar disorder symptoms. Whenever someone in the family or a familiar person suddenly acts strange and the behavior can be associated with some kind of mental disorder, it is important that symptoms must be seen and accurately determined to be able to know the kinds of treatment for the disease. A sudden gush of excitement can't be categorized as being bipolar. People have the right to be angry, happy, sad and all those behaviors. Although, when one experiences the disease, it will be most unlikely that the person will show a condition that had become tragically habitual. Typically, there are 4 episodes that a person will engage in if he or she suffers from the disorder. These episodes are: 1. Major depressive episode. Someone who is experiencing a major depressive episode in his or her life expresses symptoms like persistent emotional feelings of anxiety, anger, sadness, guilt, isolation, and hopelessness. Indifference, apathy or self-loathing, appetite and sleep disturbances, fatigue and extreme restlessness, unable to become interested in usually enjoyable activities, depersonalization and extreme loneliness, lack of interest in having sexual activities, social anxiety and shyness, chronic pain that usually triggers irritability, suicidal tendencies or morbid thinking. In worst-case scenarios, most especially if the person suffering from the disorder never had the opportunity to go into psychological help, he can become psychotic, which is also known as a severe condition of the disease. 2. Manic episode. Major characteristics of people who experience manic episodes are those that have a distinct condition of expansive, irritable or elevated mood state. Someone who suffers manic episodes experiences a common insurmountable amount of energy but lacks the capability to get proper sleep. Furthermore, the speech of the person is pressured in a way that even thoughts are racing. The attention span is decreased and can be easily distracted. Impairment of judgment can also be experienced, whereas the sufferer will undergo sprees and abnormal behavior that is quite unusual on his or her part. Indulging in substance abuse can also be possible. Substances may include depressant drugs, stimulants, and even sleeping pills. Behavior may range from being intrusive or aggressive. Grandiose and delusional ideas may become prominent. During extremes, a person may exhibit psychosis, which is a factor that perceives fantasy more than reality. 3. Hypomanic episode. This is the lesser part of the mania episodes. Extremes are less prominent. Symptoms and attitudes are also decreased. When a person experiences a hypomanic episode, he would feel sudden uncontrollable behavior like laughing out loud even with no specific reason behind it, or there might be a reason, but it would be shallow. The duration of the episode occurs only for a short period of time. Oftentimes, this is associated with the artistic mind of the person involved because intelligent thinking, a flight of ideas, and an abnormal increase in energy can be seen. 4. Mixed episode. Mixed episodes usually refer to the combined state of depressive episodes and manic episodes that may occur simultaneously. Some of which are experiencing impulsiveness, racing thoughts, rage, agitation, paranoia, aggressiveness, etc. It is better that one understands the different episodes a bipolar disorder expresses in order to diagnose the disease earlier and treatment can be performed. Do away with suicidal thoughts. People suffering from the disease can have suicidal episodes or morbid thinking. The fact is, thoughts of killing oneself because of depression and anxiety are very common among sufferers of the disorder. The moment these thoughts are overcoming your senses, it's time to seek for help from trusted people. Reaching out is better than dealing with the disorder alone. Some of the best things to do when tendencies arise are: contact your psychologist or your mental health provider and confide regarding your thoughts and how you feel. Contact a member of the family or a close friend. Talk to a spiritual leader, a minister, or a pastor who is in charge of your community. Call a crisis hotline. Helping yourself at the early stages can produce results that can make gradual coping from bipolar disorder. All you need to do is ask help from people around you. Understanding suicidal tendencies through bipolar disorder. Before going into the rough details, we'll have a rerouting of ideas to know the main reasons why people who have bipolar disorder results in suicide. First, there are generally two types of bipolar disorder, which are bipolar I and bipolar II. These two subtypes can be regarded as symptoms that are appropriate basis for diagnosing the disease. Bipolar type 1. In this occurrence, the person may at least have one or two manic episodes even without episodes of previous depression. Bipolar type 2. The person must at least have an episode of depression and a hypomanic episode. Hypomanic episodes usually refer to a lesser and much briefer condition compared to a manic episode that lasts only for a few days and not at all severe. Hypomania episodes would be associated with elevated moods like irritability, and changes in everyday functioning that doesn't require hospitalization. Here, depression is much more longer than hypomania. Cyclothymia. This is somewhat included in the type but is considered as the milder bipolar form. Compared to the extremes bipolar people are exhibiting, cyclothymia mood swings are moderate. Psychosis. This is the time when bipolar becomes severe. The person undergoes episodes of delusions and hallucinations that detaches them from reality. Some goes into thinking that they are someone, or they see and hear things that, in reality, aren't there. With all the things related to the disorder, it all goes down to one thing: suicide. Because the person can no longer understand what is happening to him, his behavior is taking over his entire system and is overwhelming his thoughts and feelings. And because the person believes that he is incapable of doing anything good, he commits suicide. Suicide is a sin. But then again, it has become one of the most effective solutions to outrun every single problem that occurs in someone's life. If someone in your family has already been diagnosed with the disorder, it is proper that the members of the family see to it that the person is taken care of. Any thoughts of committing suicide must have immediate attention to rule out the idealism. It is advisable that the person seeks medical help. The risk of committing suicide will appear within the earlier course of the illness. To be able to diagnose if a person has suicidal tendencies, one must observe signs and symptoms such as hopeless and helpless feelings, thoughts about wanting to die or talking about the afterlife, feels that he or she is just a burden for her family and friends, abuses drugs and alcohol, writing random goodbye notes, organizing affairs like preparing for near death. Suicide is possible especially if you know someone who is suffering from an early stage of bipolar disorder. If you or anyone you know who is feeling suicidal, bipolar or not, always find ways to rid of it, like calling a doctor for advice and help, never leaving suicidal persons alone, and making sure that any access of harm that the person can use against himself is nowhere to be found. It is important that one understands the different causes of the disorder in order to totally prevent the risk of suicidal attempts. Life is the most important thing to be taken care of. It's a pity to see it wasted. Thank you for watching, and if you like the video, give it thumbs up and please subscribe to Healthiest Mind channel for new videos every week. We'd love you to catch up on our latest uploads below and connect with us on social media. Facebook, Healthiest Mind for Real.